I put this chart up here because I've got a hospital bias, and so as much as I'm giving the presentation, I'll do my bias. But at least I'm telling you I got a hospital bias. What this chart shows is that little thing that says CMI up there that says, that's a technical speak for case mix index. What that means is we've looked at the acuity of illness, how sick people are that are being admitted to hospitals.
Sorry, what's the CMI?
Case mix index, okay? And what we did was we adjusted all of our data to make it an apples-to-apples comparison by fiddling with the case mix index. That's all you need to know about that. So this is kind of like a real normalized data graphic representation. Because of advancements in medical treatment, more and more is able to be done outside of the hospital environment. I can remember when I first, I'm one of those people that loves to have a hernia every 10 years. It just happens. So do my brothers, and so I think it's a genetic thing. We got weak groins. But my first hernia correction, I won't tell you what year, but my first hernia correction, I was in the hospital for 3 days. My last hernia correction, which was about 2 years ago, I was in the hospital for 3 hours. Okay, so medical advances have changed dramatically. So as a result of that and a whole lot of other things, patients who actually go to hospitals now are a heck of a lot sicker. And that's what this chart is showing for you. We're moving more out of the hospital into other environments. And what's left is this rise in sickness levels for the patients that are in hospitals. That's my commercial for hospitals. So, things are changing, but it's not necessarily putting the brakes on an increase in healthcare costs. This chart graph tries to show you where the money is being spent in healthcare. All right, where's the money being spent in healthcare? Again, being hospital-centric, look at the bottom of each one of those bars. This is from 2000. This is 2008 compared to, 2009 compared to 1980. The percentage of the dollar that's spent on hospital care has dropped from 42.6% from 1980 down to 32.6%. A full 10 percentage points over that period of time. So more and more of our healthcare dollar is being spent in other places. Real quickly, test question, pop quiz. Which one is where is the greatest growth being shown? Prescription drugs. Now, how many of you think that's a bad thing?
It's very bad because they make people more sick.
Ooh.
Yeah, they made it
Be still my heart.
They made it addictive, so the government still needed more hospitals. It's a chain that never ends. Instead of focusing on preventive medicine and keep the people healthy, they make the people more sick. Yeah.
Okay.
I'm sorry, maybe I'm very strong with
Well, I should bring. I'm going to now. You.
How about the industry by itself? I mean, the medical prescription drug industry and the like.
Yeah.
Okay. Listen. I see. I'm going to stop asking questions. I think is what I'm going to do, because that's you're just making my job more difficult here. Okay, I'm going to talk about this in a perfect world, not practical and what some of the experiences that obviously you are seeing and you're noting that exists out there. Sure, pharma is a big lobby and a whole lot of things happen. And next week, you now just gave me an idea of one graph I'm going to include in next week's presentation. Pharmaceuticals, regardless of all the stuff that's going on with them, pharmaceuticals have done a lot to keep hospitalizations down. Okay, drugs have done a lot to. Well, just look what happened with the invention of HIV drugs. Okay, that did a lot. Statins alone have caused a huge drop in the need for cardiovascular interventions, a very common malady that requires a lot of hospitalization. There's a direct connection between advancements and drugs, and its application to the decrease in healthcare consumption. Share this story with you because it tickled the hell out of me when I heard it, and it's worth sharing. My good friend, the president and CEO of the California Hospital Association, he's from the Midwest. He's from Missouri. Comes from farm stock. Family's got good genes. He's over 70. His dad, before he died, was like 96. But a few years ago, before his dad died, here's what happened. He's busy doing work, out doing his work. He gets a call. You need to show up quickly because we're not sure how much longer. Your dad's been taken to the hospital in Missouri, and we're not sure how much longer he's going to be alive. So he gets on the plane. He drops everything, gets on the plane. He flies to Missouri. He gets there. His dad is out. I don't know if he was in a coma, but he was out. So my friend, who knows a lot about healthcare and healthcare system, asked the doctor, well, what's going on? And so they described what brought his father in. And they said, in order for us to diagnose him, we started weaning him. Dad was on a number of different medications because of chronic diseases that he had. We needed to take him, wean him off of the medications to see, and then, to find out what it was that was doing. And so my friend said, so this happened, he's near death because you took him off his meds. And he said, well, yeah. He said, well, put him back on the damn meds. Why are you trying to figure out what the hell's going on? Just put him back on the damn meds. Put him back on the medication. 2 days later, he's up and out of the hospital. That's drugs do a lot. Anyway, but that's and by the way, I don't get paid by pharma. It's just, now, you would think too that growth growth in hospitals or growth in resources adds to healthcare costs. It is true, but what I wanted you to see is that as far as hospitals in California are concerned, we're not seeing any net growth in hospitals. The green bars over time, from 2001 to 2010, represent the number of beds or the change in the number of beds in California. And the orange line is population change. So population is going up, but the number of hospitals in the aggregate, of course there are hospitals, that beds being added here and there, but in the aggregate, the total number of hospital beds is not going anywhere. This one is what should worry us. This is also what worries us and what Obamacare attempts to deal with. And again, we'll get into it later, but right now I just want to give you the background of the issues. We have a huge problem being able to meet the future needs of the current population and the future populations on health insurance because we're losing our practitioners. Basically, the average age of a nurse in a hospital, anybody want to guess? Who said 46? Close, 48. Okay, the average age of a nurse. Now, right now, there isn't a real dramatic nursing shortage, but I'm telling you, when you look at that, physicians, almost a quarter of the physicians in this country are over the age of 60. In California, it's almost 30% are over that age. We are projecting that in California alone, over the next 7 years, we will need 17,000 more physicians. Guess how many are in medical schools right now, all over the country? I'll show you this chart next week, but as much as I've mentioned it now, I'll tell you now. We have 17,000 physicians that we're going to need. In all of our medical schools today, the total enrollment is about 18,500. We need every medical student that's out there in California, basically is what it amounts to. That's not going to happen, obviously. So there's some huge challenges. Now, somebody said, well, what are we doing about it? Right? What are we doing about those huge challenges? I always like to do a shout out to people who I think do good work. And my shout out today would be to Senator Ed Hernandez. Senator Hernandez, you know, is sponsoring 3 pieces of legislation which regrettably probably won't survive because of the opposition that they have engendered. But what he's trying to do is, with some allied health professions and pharmacists, nurse practitioners, physician's assistants, and optometrists, he's trying to expand their scopes of practice to allow them to work up to their full license capacity, and in some cases increase their license capacity. And the opposition, so that we can have more people who can do work at the primary care end. It's the primary care practitioners where we have the greatest shortage. Now, his legislation is in trouble, you know, but at least you got to give him credit for trying to address it. If we're not going to have all the doctors we need other people. Remember what I said earlier, 90% of us, well, not me, but 90% of everybody else needs routine care. I have a couple of chronic conditions, so I need a little bit more than that. But most people just need routine care. And what Senator Hernandez is trying to do is figure out a way to make certain that that's available to them when that need happens. But this shortage of doctors and allied health professionals is one of the biggest challenges that we've got today. Obamacare, I'll just give it to you now, as much as I talked about this. Obamacare attempts to deal with this by increasing payments to primary care physicians by 150%. Primary care doctors are the lowest paid. Specialists get paid more, obviously. You know, neurosurgeons, orthopedics, orthopedic surgeons, cardiologists, they get paid a lot more than primary care. A primary care physician on a good day or in a good year might make up to $150,000 average. Neurosurgeons and orthopedic surgeons will easily get up to $500,000. So what does that do to motivate a medical student who's finishing medical school and deciding to pick a residency and has a burden on loans of over $150,000? So where does he or she want to go? Yes, sir.
Just a quick question, sorry about that. So it calls for increasing pay 150% to primary care. Does it do anything with the workload for them?
No.
The ACA, just real quick.
No, it doesn't do anything with the workload for them. It just tries to get more of them by at least increasing their pay and therefore trying to motivate more of them to go into it. In order for a primary, I just read this yesterday. Good question, just read this yesterday. In order for a primary care physician today, the amount of primary care physicians today, in order for them to meet the needs of the current population, it would require them to work 18 hours a day. So you know, and now we're going to layer on, you know, another 34 million Americans, you know, 4 million in California, into this system that they take. You know, and that's going to be, it's going to strain them. They won't be able to go to sleep at all. It'll be 24 hours a day at least, you know. So that's what's happening there.